In 1982, congressional AIDS funding was a pitiful $297,000. By 1986, that number had jumped to $63 million. The following year, it was $146 million. By 1990, NIAID's annual AIDS budget had blossomed to $3 billion. But Gallo's HIV/AIDS hypothesis proved a PR windfall for Dr. Fauci as well. The most dangerous place in America is between Tony and a microphone, recalls Dr. Fauci's perennial Boswell, Charles Ortlib, the former publisher of the New York Native, the gay newspaper that chronicled the early AIDS epidemic, along with the Village Voice. Once people recognized that this was caused by a virus, recalled CDC's James Curran, media attention went from no news coverage to the most covered news story in history. People went from neglecting it to fear and panic. The expanded flow of cash, spelled opportunity for Dr. Fauci. AIDS was his big chance, wrote historian and journalist Bruce Nussbaum, who penned the definitive history of early AIDS research, Good Intentions, How Big Business and the Medical Establishment Are Corrupting the Fight Against AIDS. He wasn't well known as a brilliant scientist, and he had little background in managing a big bureaucracy. But Fauci did have ambition and drive to spare. The lackluster scientist was about to find his true vocation, empire building. The AIDS crisis best-known activist and most vocal critic of the NIH response, playwright Larry Kramer, may have been the first to make the cold assessment about Dr. Fauci's winning capacity for combining charm and flattery with evasion, misdirection, and misinformation to bedazzle the media into suspending skepticism and overlooking his reliable incompetence. The main reason that Fauci has gotten away with so much, Kramer observed in 1987, is that he's attractive and handsome and dapper and extremely well-spoken, and he never answers your question. Historians Torsten Engelbrecht, author of Virus Mania, and Konstantin Demeter call Fauci Dr. Baron of Lies. Asked to offer thoughts on Fauci, veteran AIDS war reporter Celia Farber pulls back and takes a broad view. She said, "People understand the arrant concept of banality of evil. You have set yourself a formidable task of deconstructing him. Why is he evil, which he is? It's not because he is so banal, so bureaucratic, so boring. That's the drag costume. In fact, he is a revolutionary, a very dangerous one, who slipped behind the gates when nobody understood what he was bringing in. What was he bringing in? He was bringing in, as a trained Jesuit and committed globalist, a new potion that would achieve any and all aims for pharma and the powers he served. The potion was then known as political correctness, now called woke. Fauci switched the entire linguistic system of American science from classical speak to woke speak. He brought in cancel culture, essentially, before anybody could imagine what it was. It was too perverse for genuine scientists to conceive of such a thing mixing with science. They couldn't believe it or grasp it, like a rape. It was incredibly confusing. That's what I documented on the ground, that horror and confusion among real scientists, as American science changes so radically before their eyes to accommodate HIV. Farber went on, "Let me elaborate a bit. Fauci's reign begins in 1984, a year of total change. Everything changes, all of a sudden. Gallo is deployed with Margaret Heckler to make the declaration by the U.S. government fiat."
This is in 1984?
Yes.
Same year as the Olympics?
Yes. Gallo is deployed with Margaret Heckler to make the declaration by U.S. government fiat that the probable cause of AIDS had been found and that it was some kind of transatlantic fusion that looked virus-like on the big screen. This again sounds like Fauci language. Vague, nebulous, ambiguous reference.
Yeah.
In other words, it can mean multiple things at multiple times depending on what you need to activate.
Language like that?
What?
Newt Gingrich.
Yes, neuro-linguistic programming and such. Yeah.
That's right.
The reason it flew, to use Nature Biotechnology founding editor Harvey Biley's word, was because everything had already changed. It was understood without overt commands that the gay cancer that had everybody in such a panic could not be assessed as complex toxic illness with a complex cause. The entire U.S. media understood what to say and not to say, and not only because of the allegiance to the shadow government, but because the era of classical science had ended. It ended that day. It would henceforth be a crime against decency to, for example, address anything that could be making gay men sick, other than the virus. That's not bad science. That's perfectly executed political correctness.
Yes.
And they are, which is magic, it's a form of magic,
Yes.
It's a form of tying the tongue. And they are diametrically at odds in the biblical sense of good and evil. What Fauci did was he made political correctness the new currency of his funding empire. Peter Duisberg was not wrong about HIV and AIDS. He was politically incorrect about it. And that was how Fauci banished him. Sentenced him to funding and reputation death as though he had done something really bad by dissenting against HIV theory. Stop and think how insane this is. An elite cancer virologist brought over from Germany's Max Planck Institute, whose credentials are so outstanding, who was well on his way to solving cancer's genetics, felled suddenly, as if by fatwa, issued by this mufti? Who was he to issue a fatwa against America's top cancer virologist? What?
Try to read it straight so I can understand it more.
I can't read it because I can't see it, and I can't concentrate on what I can hear of myself reading because you're crackling behind me. So,
Well, that statement was really good.
it's
I was wondering where it was
smaller
going.
font, and I can't read it all that well from... Okay, so I'm trying to stop and think how insane this is. An elite cancer virologist brought over from Germany's Max Planck Institute, whose credentials are so outstanding, who was well on his way to solving cancer's genetics, felled suddenly, as if by fatwa, issued by this mufti? Who was he to issue a fatwa against America's top cancer virologist? Well, he did. He blocked every federal research dollar to Duisberg after 1987 because Duisberg repudiated the woke ideology of Fauci's HIV empire. In a few paragraphs of scientific paper that was about something else, he sustained the economic and reputational attack vendetta for the next 3 decades. Without blinking, it's really an unbelievable story. It would make Americans' blood boil if they knew about it, because almost all have lost somebody in their family to cancer. Oh great, more crackling. Fauci had, by 1987, when Duisberg wrote the cancer research paper that sealed his scientific fate, an apparatus that included mass media, psychological operations, public health, this octopus that just straight up throttled the entire scientific tradition of Western civilization, evidence-based science and the discourse culture that goes with it, gone. That's what he did. It's no small feat. He destroyed American science by snuffing out its spirit, the spirit of open inquiry, proof, and standards. The reason so many outstanding scientists lent their names to opposing Fauci's vendetta on Duisberg was not that they cared necessarily about the cause of AIDS. This was, for them, a battle over the very soul of science. Kerry Mullis, PCR inventor, broke down crying in an interview I did with him in 1994, talking about it, talking about what Fauci did to Peter Duisberg and the consequences of it. The real scientists were horrified. Suddenly a guillotine had become present, a new and strange terror. People were guilty of thought crimes like HIV denialism. Fauci had made political correctness the new revolutionary language, see? And that meant if you were bad, if you didn't push agenda-driven science, everything would be taken from you. And the media cheered, and anybody who didn't was destroyed, vilified, harassed, fired. In a word, canceled. His gifts for deflection, misdirection, and obfuscation, and perhaps his boyish charm, give Dr. Fauci a Teflon quality, which he shared with President Ronald Reagan, under whom he initially came to power. Something about Dr. Fauci allows him to escape responsibility for, or even mild questioning about, his steady parade of sketchy decisions, his confident claims unsupported by scientific evidence, his relentless cascade of lies and failed predictions, and his miserable track record for keeping Americans healthy. As the nation's newly appointed AIDS czar, Dr. Fauci was now gatekeeper for almost all AIDS research. NCI already had long experience and robust infrastructure for conducting clinical trials on new drugs. NIAID had neither. Nevertheless, parroting NCI's vows to cure cancer, Dr. Fauci promised Congress he would quickly produce drugs and vaccines that would banish AIDS. In his 1990 book, Nussbaum concludes that Fauci's triumph over NCI cost many thousands of Americans their lives during the AIDS crisis. Myriad contemporary critics concur with that assessment. NIAID's lack of in-house drug development capacity allowed Dr. Fauci to build his new program by farming out drug research to a network of so-called principal investigators, or PIs, effectively controlled by the pharmaceutical companies. Today, when people refer to the medical cartel, they are principally speaking of pharmaceutical companies, hospital systems, HMOs and insurers, the medical journals, and public health regulators. But the glue that holds all these institutions together and allows them to march in lockstep is the army of PIs who act as lobbyists, spokespersons, liaisons, and enforcers. Tony Fauci played a key historic role in elevating this cohort to dominate public health policy. PIs are powerful academic physicians and researchers who use federal grants and pharmaceutical industry contracts to build feudal empires at universities and research hospitals that mainly conduct clinical trials, a key stage in the licensing process for new pharmaceutical products. Thanks to NIH's largesse and to NIAID's in particular, a relatively tiny network of PIs, a few hundred, determines the content and direction of virtually all America's biomedical research. In 1987, some $4.6 billion of NIH's $6.1 billion budget went to these off-campus researchers. That's like 2/3 of the budget, right? By 1992, NIH's budget had now expanded to $8.9 billion, with $5 billion going to outside scientists at 1,300 universities, laboratories, and other elite institutions. Today, Dr. Fauci's NIAID alone controls $7.6 billion in annual discretionary expenditures that he distributes mainly to PIs around the globe. PIs are pharmaceutical industry surrogates who play key roles promoting the pharmaceutical paradigm and functioning as high priests of all its orthodoxies, which they proselytize with missionary zeal. They use their seats on medical boards and chairmanships of university departments to propagate dogma and root out heresy. They enforce a message of discipline, science criticism, censor contrary opinions, and punish dissent. They populate the Data and Safety Monitoring Boards, or DSMBs, that influence the design of clinical trial protocols and guide the interpretation of clinical trial outcomes and conclusions. The External Advisory FDA Panel, Vaccines and Related Biological Products Advisory Committee, VRBPAC, that guides determination on whether new vaccines are safe and effective and merit licensure or marketing, and the CDC panel, the Advisory Committee on Immunization Practices, the ACIP, that essentially mandates vaccines to children. They are the credentialed and trusted medical experts who prognosticate on television networks, now helplessly reliant on pharmaceutical ad revenue to push out pharma content. These experts, Paul Offit, Peter Hotez, Stanley Plotkin, Ian Lipkin, William Schaffner, Kathleen Edwards, Arthur Kaplan, Stanley Katz, Greg Poland, Andrew Pollard, appear between pharma ads on network and cable news shows to promote the annual flu shots and measles scares, to drum up fears about COVID, and to rail against those anti-vaxxers. They write the steady stream of editorials that appear in local and national newspapers to reinforce the hackneyed orthodoxies of pharmaceutical paradigms. All vaccines are safe and effective, etc. They root out heresy by sitting on the state medical boards, the Inquisition courts that censor and de-license dissident doctors. They control the medical journals and peer-reviewed journal literature to fortify pharma's agenda. They teach on medical school faculties, populate journal editorial boards, and chair university departments. They supervise hospitals and chair hospital departments. They act as expert witnesses for pharmaceutical companies in civil court and the federal vaccine court. They present awards to one another.